What do you like most in a patient? His humanity or the variety of the cases?
Sometimes their teeth are in beautiful alignment and everything looks nice, and other times the teeth are crowded and difficult for the patient to clean, and we have to think about different ideas as to how to resolve the problem. And most patients ask the same questions. The questions are very similar in the beginning. How much discomfort will I have? How much expense? How many visits will I have to make to the office? I'm sure these are the same questions. What will I look like? And finally, well, if I do everything you say, how long will the result last? The longevity. And when I was in my younger years, the excitement was just doing. And as the years have passed, I've realized that we have very little information in an organized fashion of the long-term effect of treatment. If I'm on a panel at a meeting, frequently the oldest case that I'm listening to has ranged between 4 months and a year, and yet really the patient's asking the question, and if I was the patient, I would ask the question, what will the result be after a long period of time? And this has become of great interest to me as the years have passed. But I'm very comfortable and very much at ease and find it very pleasant to actually work with the patient and to do the procedure.
Excuse me, how do you find the time to go on with those activities? It is very difficult, not only under the scientific points of view, but also to find time, because I suppose you have a family.
We were talking earlier, and I said that at some point I realized that I could not continue to do everything I was doing, because I'm on the faculty of different schools, and there were a lot of commitments. And at that time I decided that I could get along very well, or my practice could, because we have other people in the office, if I did less work in the office and devoted myself more to my research interests.
I was told that you have follow-ups of 32 years. It is not so customary that a doctor has 32 years of follow-up. Do you think so?
I know this is unusual, and to push it a little bit further, the oldest case study that I'll show tomorrow is 57 years.
57?
But I didn't begin with the patient. The patient began in the office before I was practicing. I went into practice with the person who was the professor and chairman of the department at the university. Mm-hmm. So I got a little bit of a quick start, and I think what has helped keep track of these people for such a long time was that we ran our practice academically, so that we had all of the x-rays organized properly, we had all of the patient records organized properly, and as years went by and the cases aged, I always had the information that they began with.
And tomorrow will you show some particular case in Tuscany? Some curious or particularly interesting case?
What we will do tomorrow is first establish that patients would like to keep their own teeth. And the first decision we have to make is, what is the better option for a patient? Sometimes it's one tooth we're evaluating. Sometimes it's all of the teeth in the maxilla, or the upper arch, or the mandible, the lower arch. And these are serious decisions for a patient. There is nobody that can show implant cases that are as old or that have the longevity as the cases I can show with teeth. But I do have some old implant cases, because I started at a very young age with implants.
Whether you would bring something new, particularly new tomorrow?
Well, for me personally, the biggest interest has been when they were able to resolve the human genome. And now this enabled the opportunity to be able to understand the proteins that work in healing. Bone is what my major interest is. And two of the proteins that they have found and isolated from bone morphogenic protein 2 and platelet-derived growth factor, can now be manufactured in a recombinant form. First of all, some of the leaders here trained with us in Boston, so I know them very well. But I think the top level of dentistry in Italy is the equivalent of anywhere in the world. I think that there's always a mediocrity and there's always a disappointment. And I think that there's certainly a fair amount of that. But I think that the leaders in Italy, without naming people, to come here and to witness the office that Dr. Cardiolapi has here, and to see what he's doing, and as the person who has published some of his papers in the journal that I edit, this is what's fantastic. It's the passing down of information. And I think that really and truly some of the dentistry in Italy is fantastic.